Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top news. First heart transplant surgery at RML Hospital in Delhi. The Atal Bihari Vajpayee Institute of Medical Science, Dr RML Hospital, on Wednesday conducted its first heart transplant on a 32-year-old woman. This is the historic and successful first heart transplant surgery at a central government-run hospital in New Delhi. A team of cardiac surgeons from RML hospitals and AIIMS led by Dr Narender Singh Jhajhria reached PGI Chandigarh the same evening and harvested the donor heart, which was then expeditiously flown to New Delhi within 2 hours by dint of a green corridor arranged by PGI MER Chandigarh, Delhi and Chandigarh Police Department's Airlines Manager of Alliance Air. Speaking to Medical Dialogues about the surgery, we have Dr Vijay, Head of CTVS, RML Hospital. Welcome to Medical Dialogues, Doctor, and heartily congratulations to you on success of the surgery.
The first heart transplant which happened in the RML Hospital. So,
Yes.
how it's going to affect further to the public and the poor section of the society?
See, heart failure is a disease which is being now identified in a lot of patients. That burden is quite a lot now, especially in the poorer class who are not amenable to this kind of treatment like heart transplant. The poorer sections of society, especially in Delhi and NCR, were only going to All India Institute of Medical Sciences for this kind of therapy. None of the other government hospitals was providing this. Right now, we have become the third hospital in the government sector in the whole of NCR to provide this therapy. And that is All India Institute of Medical Sciences, RNR of the Army, Armed Forces, and RML Hospital Delhi.
Right.
Out of which RNR Hospital caters to the staff of the Army, staff and dependents of the Army, Armed Forces, that is. So this is a big boon to patients who are poor, who cannot afford anything, because that treatment is at the moment absolutely free from the Government of India side.
So what were the complications faced during the whole procedure?
See, heart transplant is a challenge in more ways than one. One, the surgery is complicated in the sense that it is a long surgery. Second thing, it entails retrieval of an organ from a donor. The donor may not be on the same hospital as you plan to do a transplant. Like in this case, the donor was in Chandigarh.
Right.
So we had to send a team across to Chandigarh, retrieve the heart from there and reach in time for the transplantation. But there is what is called an ischemia time. That should only be 4 to 6 hours.
Right.
So after we retrieve the organ from the donor, it should be implanted within 4 to 6 hours. The procedure should be completed in 4 to 6 hours. So that is the biggest challenge, timing. The procedure is generally carried out at odd hours because of this whole process of certifying brain death, followed by consent from the family, followed by retrieval, followed by transportation and then surgery. So generally it's carried out in the late hours of the night. So that's the second challenge. Third challenge is, of course, the surgical process. It is a long surgery, although it is now being more a foreign body that has been implanted in the patient. That therapy may predispose the patient to various amount of infections. So we have to suppress the infection, make sure that patient does not get any infection and does not, after the surgery, is kept in a place where it is isolated and strictly monitored for any sign of infection or rejection. These are essential challenges faced by any transplantation, heart transplantation especially.
Right, sir.
So what is how is the patient now? What are the prognosis? Is she completely fine?
One very good thing about this patient was that the patient is young. She's a 32-year-old female, so she's relatively young. So all the other body organs, other body systems are normal, except for the heart. Now, the patient was operated on Sunday night and early morning transferred to the ICU, following which the patient was kept in the ICU, and next day on the Tuesday morning, patient was weaned off the ventilator and taken off the ventilator. Subsequently, patient now is mobilized in the ICU premises. Patient is hemodynamically stable, blood pressure, everything is normal, but we are keeping in the ICU for observation and prevention of any infection. Patient is mobilized in the ICU, walking, talking, speaking, eating food, normal food.
Okay, that's really great that she's completely well. So what is your message to the society regarding the organ donation?
That's a very big challenge. Without the donors, we are nobody. We are nothing.
Yes.
If there was no donor, there would be no surgery, no cardiac surgeon will be doing it. No surgeon will be retrieving organs and putting them in the recipients. So without the donor, we are at zero level. But last 20 years, slowly the community has started to understand that donation is possible. Donation is not going to affect because the concept of brain death has now been accepted. That if the brain is dead, the patient will not survive. They cannot never survive. So they understood the concept now. People are slowly understanding. It takes some time depending on the literacy or illiteracy level. But it's a sense of conviction that we can do a lot of good deed by donating organs that has started percolating in society. In this patient also, if you look at the donor also is a person from the poor society. In spite of that, he agreed to the cause of donation, and the person, the family donated not only the heart but the cornea, the liver, pancreas, and 2 kidneys. So they have done a very, very big gesture to humanity.
Thank you for your time, sir. The case was managed extremely well with tremendous efficiency and expertise of Dr. Vijay Grover and his team. Salute for giving new lease of life to patient, and thank you so much. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.